Hey, FranU Clinical Partners. This is Mary Cantro, newly appointed DCE for the FranU DPT program. I'm here with some exciting and important news regarding our clinical education program. As of January 2024, FranU will no longer be using the APTA CPI evaluation tool for clinical performance. The decision to make the change was based on programmatic assessment and generalized feedback that the CPI tended to get long, redundant, and difficult. Upon research and investigation of the Clinical Internship Evaluation Tool, also known as the CIET, after being introduced to it at the APTA Educational Leadership Conference, the Clinical Education Committee, with approval from the DPT Executive Committee, made the decision to move forward with the use of the CIET. The tool was developed by the University of Pittsburgh in 2007 and has been shown to be a reliable and valid tool by multiple programs across the country. So as you can see, these are some of the objectives of this PowerPoint for our particular program. We're going to update you on some of the changes which we've already discussed to our clinical education, get you familiar with the CIET, define its important terms, our required performance levels for each clinical experience, and how to use the CIET rating scale in general. This training and other training should take less than 30 to 45 minutes. However, we do provide additional resources specific to our program and the tool, and we're available via phone or email if you have any questions or concerns following the training. No worries, there's no separate account or password required. You'll receive an email link at the address you provided to me and or your student, and if you want to change that email address, just let us know and we can get it changed for you. A quick review of our program's mission. I won't read it to you, but I will give you a few seconds to review it. And then some other changes, as I discussed, to our clinical education program is that I've taken over as the Director of Clinical Education, and Dr. Jennifer Watson will be the Assistant Director of Clinical Education. Dr. Jeffrey Thompson, who you all have probably worked with in the past, has moved on to be the Dean of our Health School of Health Professions here at FranU. So we're excited to have him in that position and look forward to working with you all in the upcoming years. So as I mentioned earlier, the Clinical Internship Evaluation Tool is a reliable and valid tool that was designed at the University of Pittsburgh and has been in use since 1999. It was developed to assess DPT student performance relative to that of a competent clinician, and a competent clinician in the setting in which they've been placed. And competent clinician is defined as below. The student is able to skillfully manage the 100% of the caseload in an efficient manner to achieve effective patient-client outcomes. There are three main sections to the tool, which I will explain in more detail, and which are explained in much more detail in the FranU DPT CIET Handbook and Clinical Education Manuals. The sections include professional behavior, which includes subsets of safety, professional ethics, initiative, and communication skills. The patient management skills include subsets of examination, evaluation, diagnosis, prognosis, and intervention, with all of these leaving room for written comments as well. Following the completion of these scales, the CI can also provide summative comments and rate the student on the global rating scale as seen below. It includes an overall assessment of performance between well below a competent clinician and well above a competent clinician. And the CI will also be asked to provide a final indication of satisfactory performance via a yes/no question. The no alerts us that the student has not been successful in the clinical experience, and the university should be contacted immediately for further discussion. The professional behavior categories are listed below. There are 4 subsections, and they are defined in detail in the handbook and CIET training. Safety behaviors address whether the student is following all health and safety precautions required at your facility, along with taking any other measures needed to maintain both the patient's safety and their own. Professional ethics addresses the student's knowledge of and compliance with all rules, regulations, ethical standards, legal standards, and their professional appearance and conduct in the clinic during all interactions. Initiative addresses the student's ability to maximize all opportunities for learning during their clinical affiliation, begin to problem solve independently, seek out, accept, and implement constructive criticism, and develop teamwork and flexibility in the clinical setting. Communication skills look at both their ability to verbally communicate with patients, families, and other healthcare professionals, along with their written skills with documentation, home programs, and other required paperwork. These skills are measured by their frequency of behavior, as seen on the chart above. Never, the skills are performed 0% of the time, rarely, less than 25%, sometimes, approximately 50%, most of the time, greater than 75%, and always greater than 95%. The patient management skills are defined as those in the APTA Guide to PT Practice. Examination includes all aspects of gathering data from the patient, including history, systems review, and performing tests and measures. Evaluation is the analysis and synthesis of the data gathered in order to determine a diagnosis and plan of care for the patient. The student should demonstrate their development and their critical thinking skills during the evaluation process, including determining the patient's impairments and functional limitations and how they relate to activity and participation limitations. Diagnosis and prognosis involves all aspects of developing a plan of care for the patient, including determining a diagnosis for physical therapy management, determining the prognosis or outcome for the episode of PT care, and determining the appropriate frequency and duration of care, including criteria for discharge and determining the appropriate treatments. Intervention includes the student's ability to apply those treatments, perform patient and family education, monitor the patient's response to treatment and adapt accordingly, and recognize when the outcome has been reached. For all areas of patient management, the student should be using the best available evidence in their decision making. So the way in which students are evaluated regarding patient management skills include the type of patient and the amount of clinical instructor support required for such patients. The types of patients include familiar presentation and complex presentation, as noted here. So familiar presentation includes patients that have diagnoses or problems that are frequently seen in your setting, that the students have evaluated and treated more than once, that's specifically covered in the student's didactic curriculum, and patients without complex medical history or complicated courses of care. The complex presentation includes patients that have diagnoses or problems that are rarely seen or rarely seen in your setting, not covered in the student's didactic curriculum, or patients with complex medical history or complicated courses of care. The amount of clinical instructor support is defined by these categories: guidance, supervision, and independence that are defined below. Guidance is when the student is dependent on the CI to direct the evaluation and patient treatment. The CI is present throughout the entire interaction, or the student needs to discuss with the clinical instructor after each step of the evaluation and treatment. Supervision is when the student is able to carry out the evaluation and treatment but needs to be monitored to correct minor errors in technique or to facilitate decision making. The student is able to make correct clinical decisions with only a few verbal cues and suggestions from the clinical instructor, and the clinical instructor is not directing their decision making. Independence is when the student is directing evaluation and treatment and getting an effective outcome. If the student is coming to the CI for consultation about a patient's evaluation or plan of care, or is clarifying a clinical decision, this is not considered supervision. It's considered independence. The student is demonstrating the skills of a competent clinician at that level and is demonstrating skills of adult learning, active problem solving through the use of evidence and discussion with peers. So the grading levels available to classify students' patient management skills are below. They range from well below to above, with the definitions that are listed here. Well below means the student requires guidance from the clinical instructor to complete an item for all patients. Moving to below, students require supervision or have difficulty with time management while completing the item for all patients. The student should continue to require guidance for the patient with a more complex presentation, while only needing supervision with the patient with a familiar presentation. The next level is at that level for familiar patients, when the student is independently managing patients with familiar presentations. They're at the level of a competent clinician with these patients when performing the item. Students require supervision to manage patients with a complex presentation and are below the level of a competent clinician for these patients. At that level for all patients is when the student is independently managing both patients with familiar and complex presentations. The student can carry an appropriate caseload for your clinic and achieve an effective outcome with patients. The student is at the level of a competent clinician in your setting. Above is when the student is performing above the level of a competent clinician. The clinical skills are highly effective and demonstrate the most current evidence in practice. The student can carry a higher than expected caseload and they actively seek out and develop independent learning opportunities. They may even serve as a mentor to other students and provide resources to the clinical staff. In addition to using the tools previously discussed, which evaluates the overall professional behaviors and patient management skills, we've also developed clinical performance benchmarks to guide the expectations of students throughout their clinical education experience. The benchmarks are specific for each clinical education experience and are listed in the upcoming slides and also in the FranU CIET Handbook and Clinical Education Manual. As noted here, all of FranU DPT professional practice clinical rotations occur after the completion of all the students' didactic coursework, except for one wellness course, which is online in the summer semester 6 when they're performing their first professional practice. So, FranU specific benchmarks for professional behavior are as follows. The clinical education benchmarks for FranU are listed on this chart, with the progression from professional practice 1 through 2 and 3. These were developed with input from the Clinical Education Committee, the DPT Executive Committee, as well as other universities who are currently using the tool. Remember that these are graded based on the percentages the skill is actually performed, ranging from 0% never to greater than 95% always. If any of these skills within the professional behavior section are rated as never or rarely, please contact the DCE immediately to discuss options for improving the performance. Also note that not observed can only be used for the communication domain. If there's infrequent opportunity that allows for this to be appropriately and accurately rated within your setting. The FranU CIET benchmarks for patient management are as follows. These are the clinical benchmarks for each skill within the patient management section. There are specific expectations for each skill as well as a certain number of items within the section that must be at or above a certain level by the end of the rotation. Please take a minute to review these charts, which are also listed in the Clinical Education Manual and CIET Handbook. If you have any questions, please do not hesitate to reach out to us so we can make sure to continue to utilize the tool as an accurate and reliable tool to assess our students' clinical performance. This is the continuation of the expectations in the patient management section. Please note these expectations are significant for only FranU. Other universities may have other benchmarks and criteria to meet for their rotations. The final part of the CIET is the global rating scale, which provides an overall assessment of the student's clinical performance. FranU's expectations of performance on this scale are reflected on the chart. If there are any safety concerns or red flags at any point in the rotation, please contact me or the assistant DCE immediately. The overall goal is for the student to reach a 7 or above in all categories by professional practice 3, their final long-term rotation. This signifies a competent clinician rather than an expert or clinical specialist. Levels 8 through 10 are reserved for students that demonstrate exceptional clinical performance. As a reminder, the global rating scale was initially utilized to be an external validity tool. It allows the CI's judgment of the student's competence and is used as an accessory tool to show growth of student performance. It is not a standalone measure used to determine satisfactory or unsatisfactory performance and should not be valued as much as the individual items and specific comments listed on the previous sections of the CIET. A small note here is that advanced practice settings are expected to be scored at a lower level than the regular expectations. For example, after completing the global rating scale for someone in a specific specialized setting like neurologic rehab or vestibular rehab or concussion management or sports, the student may be listed at a 6 at their final professional practice because of the specialty of the setting. After the final rating, if there's any question that the student is performing at a level that is satisfactory with his or her level of education, the CIET will prompt you to contact the school and DCE immediately with the yes/no question as we discussed prior. So what is the timeline for assessment using the CIET? The CIET, just like the CPI, is used to evaluate the student's performance at the midterm and final week of the clinical experiences. The students will first complete their self-assessment and then the CIs will complete their assessment of the student for both midterm and final. The CIET is completed electronically through an online clinical platform, EXAT, and once the student has completed their self-assessment, the CI will receive an email with no login or password needed to complete their assessment. So there have been some changes to the workflow of using the CIET and EXAT if you've utilized it before. It used to be that students had to complete their evaluation first before the CI could do it, and then the CI could actually see the student's comments. There's now a concurrent workflow, so CI and student can both work on it at the same time and not see each other's comments. Then they can review together to submit to the school for both the midterm and the final. There are some great detailed instructions on this link to the exact website of the workflow and how to utilize it. But if you have any specific questions as you're going through the process, please feel free to reach out to me. These are just some screenshots of what the email you will receive from EXAT will look like once the student has completed their evaluation, and the yes/no question of whether you have completed the training for the CIET once you enter the EXAT platform. Also included are some screenshots of the tool from the EXAT platform and what it will look like. You'll see the circle buttons where you can select the student's appropriate rating for both professional behaviors and patient management. Finally, you will select your student's rating on the global rating scale of clinical competence with on this slider scale, and then denote on the yes/no question if the student is performing at a satisfactory level for his or her current level of education, and then sign, and you're complete. So we've been using the CIET for a full year now, and as I've gone through and graded and reviewed a lot of these evaluations over the past year, I've run into some similar areas of confusion. So I just wanted to go ahead and put those out there to try and prevent some questions and confusion for you guys moving forward. The first thing is that while it seems quite confusing, always is considered greater than 95% of the time when you're grading the professional behaviors. So it doesn't have to be 100% of the time, just as long as they're 95% of the time or more completing and demonstrating those professional behaviors. I've had some issues with students more than CIs understanding the relevance of the hypothesis, diagnosis, and prognosis definitions for the inpatient setting, right? So sometimes students are stuck in the world of a diagnosis means you're giving them a specific diagnosis related to a tissue injury. But in the acute and inpatient setting, the diagnosis, prognosis, and the hypotheses can be related to their PT diagnosis, right? And the hypotheses related to what underlying impairments are causing issues with function in these patients. So while different than the orthopedic setting, these items do have relevance in the inpatient settings, which I'm sure most CIs are aware of, but just wanted to clarify that it can work both ways across all settings. Making sure as a CI that you're checking yes or no at the end of each section where the question asks, did the student meet the expected clinical performance benchmarks for ... so for diagnosis or for examination. It's going to ask you that at midterm and at final, and it's going to make you answer that question. However, we don't have listed benchmarks for midterm, so unless you don't think the student is going to progress towards meeting the benchmark by final, then you can just select yes at midterm. If you have concerns with a specific area of performance for them, definitely select no, and that will cue me to reach out to you guys regarding what your concerns are if we haven't already discussed, and make a plan for progressing that student forward, moving forward. And then for the last one, make sure if you select yes, that the grading within that item matches our required benchmarks that are listed in the clinical education manual and the CIET handbook. So sometimes what I'll find is folks may have a student listed as at that level for familiar patients when the requirement is at that level for all patients, but then they select yes for did they meet the requirements, and so that's some conflicting data. We're working on getting Exact to correct that for us and have it customized for our benchmarks, but for now, if you could just go back and double check that the benchmarks are meeting the answer to your question, that'll save us some emailing back and forth at the end of each student's affiliation. Thank you so much for your time. Please do not hesitate to reach out to me and or Dr. Watson regarding any questions or concerns you have regarding the tool. We look forward to working with you in the upcoming semester as we transition into the utilization of the CIET.